National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at nationalnutrition.ca. Diverticulitis is a very common ailment in my office. It's something that a lot of people in our society suffer with. Many of you may not have discussed this with your friends and family, so you don't realize how many people around you actually also might suffer if you do suffer with it. Now, what it is, again, a lot of people don't understand this condition very well. So first off, you have to understand the difference between diverticulosis and diverticulitis. Diverticulosis is the production of a lot of small pouches in your intestinal lining. So instead of being kind of like a nice smooth tube, you've got all these little like side outpouchings, and those are called diverticula. And if you have multiple of them, you have diverticulosis. Now, when those little pouches get inflamed, that's when you develop diverticulitis, and diverticulitis can be a very uncomfortable condition. Many patients walk into my office and they happen to sort of in passing say, oh, and I also have diverticulitis. What they typically are actually mean to say is they have diverticulosis because it's not actively inflamed. So where does this come from? Well, diverticulosis typically develops as we age through weakening of the muscles of the intestine. If you have to, there's 2 layers to the intestinal lining, and as the outer muscular layer weakens over time, it gets stretched, that will cause the inner layer to form these little pouches that we call diverticula, and that leads to the development of this condition. Now you'll notice I say condition because it is not always diverticulitis. That's something else where typically due to a bacterial infection or some food particle getting caught in the diverticula and rotting, leading to the inflammation of that pouch, and that causes the diverticulitis. So where does diverticulosis come from? Well, it develops with age due to some sort of chronic intestinal ailment. If you're chronically constipated, you're at a higher risk of diverticulosis. If you have to strain a lot to pass stool, or if there's some other chronic condition of the intestine, that can lead to these pouches being developed and then lead to them eventually becoming inflamed and developing true diverticulitis. So best thing you can do if you have diverticulosis is, of course, prevent the disease. So to prevent the inflammatory version of it, which is the diverticulitis. So what you want to do is make sure you supplement with things like probiotics to ensure healthy bacteria colonies in your gut, reducing the chances of infection and diverticulitis developing. And you can also do things like, manage your diet, eat a very anti-inflammatory diet. Make sure you eat lots of fiber. A diet very rich in vegetables is the easiest way to get adequate fiber into your system. I always preach to my patients, try and get 10 servings of vegetables a day. I mean, how many vegetables did you eat for breakfast today? One of my recommendations, try to get at least 3 servings of vegetables at every meal. That's an easy way to help you attain 10 servings of vegetables a day, which can greatly decrease your risk of diverticulitis amongst a plethora of other diseases. Now, if you do get the diverticulitis, it may need some, very aggressive treatment depending on the level of infection or inflammation that you've got. If it's an infection causing it, you might need some sort of antibiotic therapy, be that pharmaceutical or herbal. And in very, very severe cases, due to the swelling and inflammation that can come with the condition, it can actually require surgical intervention. So this is why I'm so big on preaching avoidance of the condition. Now, if you do have it and it's a more mild case, it doesn't require surgery, things like L-glutamine have been shown to be very effective in the management of diverticulitis, as well as anti-inflammatory herbs. Again, slippery elm would be very helpful in managing the inflammation of diverticulitis. Curcumin, which is a very good anti-inflammatory, would also be helpful, as well as an anti-inflammatory enzyme known as bromelain. So these things in combination can help reduce any type of inflammation that you're experiencing. And then with inflammation, you're going to get corruption of the normal digestive process. So one of the things you might want to add in just to ensure better digestion while going through a bout of diverticulitis is a digestive enzyme, just to help you break down your food, prevent the excessive fermentation of that food that could actually contribute and further exaggerate your symptoms. So I hope you've learned a little bit about diverticulitis and the difference between it and diverticulosis. If you have any questions or comments, please post them below. Subscribe to our YouTube channel. And as always, remember, knowledge is health.